Welcome back to our channel. Today we will discuss about the most important key points for the all type of nursing exam, mainly for the norcet. Day 1. Let's start. General concept. Health is defined by who as a state of complete physical, mental and social well-being and not merely the absence of disease. Next, nursing is defined as assisting individuals and the performance of activities contributing to health, recovery or the peaceful death told by the Virginia Henderson. Next, scope of the nursing includes preventive, promotive and the curative and rehabilitative care. Next, primary health care includes equitability, distribution, community participants and the intersectoral and coordination, appropriate technology, focus on the prevention. Holistic nursing. Holistic nursing means consider physical, emotional and social, culture and the spiritual aspects. Next topic is infection control and asepsis. Medical asepsis means use in the clean techniques. Surgical asepsis means use in the sterile technique. Hand hygiene is the most effective method of the infection prevention. What is the most important method for the infection prevention? It is and the hand hygiene. Standard precaution applied to all patients regardless of the diagnosis. Isolation types. There are the 4 types of the isolation: contact, airborne and droplet and protective. Sterilization kills all forms of the microorganism including spores. Disinfection kills most but not the spores. Next topic, vital signs. Normal adult temperature is 36.5 to 37.5 degree centigrade. Oral temperature 37, rectal temperature 37.5, axillary temperature 36.5 degree centigrade. Normal adult pulse rate is 60 to 100 beats per minute. Tachycardia. When the heart rate is more than 100 beats per minute, it's known as the tachycardia. When the heart rate is less than 60 beats per minute, known as the bradycardia. Normal respiration rate is 12 to 20 per minute. Normal BP is 120 by 80 mm of Hg. Hypotension, when it's come down less than 90 by 60, is known as the hypotension. Hypertension, when it goes up more than 140 by 90 mm of Ag. Next, oxygen saturation normal is 95 to 100%. Pulse deficit means apical pulse minus radial pulse. MEPP, mean arterial pressure, means systolic BP plus 2 diastolic BP by 3. Normal is 70 to 105. Next, fluid and electrolytes. Normal sodium level is 135 to 145 millicu per liter. Normal potassium level is 3.5 to 5 millicu per liter. Normal calcium level is 8.5 to 10.5 mg per liter. Normal magnesium level is 1.5 to 2.5 millicu per liter. Normal chlorine 98.98 to 106 millicu per liter. Causes of the hypokalemia. When the potassium level is decreased, known as the hypokalemia. What is the causes? Muscle weakness, arrhythmias and the ileus. Hyperkalemia causes peaked T-wave and muscle paralysis. Hyponatremia causes the confusion, seizure and the coma. Hypernatremia. Hypernatremia causes thirst, irritability and edema. Normal urine output minimum 30 ml per hour. Positioning of the patient. Next topic. Fall position. 45 to 60 degree head of the bed elevation for the dyspnea. Difficulty in breathing. Semi-fowler is 30 degree elevation post abdominal surgery. Trendelenburg position. Head low and for uses for the shock, venous return, and reverse Trendelenburg position. Head up. Head will be the up like that, and it is used for the GERD, gastroesophageal reflux disease. Lithotomy. For the pelvic examination and the delivery, we used for the lithotomy position, pond position. Post spinal surgery and the unconscious patient, we used the pond position. Sims position mainly used for the enema and the rectal examination. And left lateral for the recovery position, orthopenic, severe COPD and asthma. Next, knee chest position, rectal and proctologic exam. And next topic, oxygen therapy. Normal nasal cannula, flow rate 1 to 6 liter per minute. FiO2 is 24 to 44%. Simple face mask 5 to 8 liter per minute. FiO2 40 to 60%. Non-elevator mask 10 to 15 liter per minute. FiO2 up to the 95%. Next, Venturi mask. Venturi mask is mainly used for the COPD patient. Precious FiO2 and 24 oxygen level is 24 to the 60%. Next, oxygen toxicity. When the flow rate is greater than 50% of FiO2 for the 24 hours. COPD patient need low flow O2 1 to 2 liter per minute. Humidification prevents mucosal dryness. Next, oxygen is a drug. It requires prescription. If you are giving the oxygen, this is also conduct like a drug. Without prescription, you can't give the oxygen. Safety: no flames and smoking near the O2. Pulse oximeter is unreliable in shock, hypothermia, carbon monoxide poisoning. Next, infection control and the safety. Chain of infection: at first agent, then reservoir, portal of exit, mode of transmission, then portal of entry, then suspectable host. Breaking chain is frequent hand washing, PPE, personal protective equipment, and isolation, sterilization. And most common hospital acquired infection is the UTI, urinary tract infection, from the catheter. Contact precaution should be gloves and the gown. Airborne precaution should be N95 masks, negative pressure from the room. Droplet precaution should be surgical masks within the 1 meters. Protective isolation: immunocompromised patients, example chemotherapy. Autoclaving 120 degree centigrade. We use the autoclaving for the surgeries equipments like the surgery forceps. 15 psi and 15 to 20 minute gold standard sterilization. Dry heat sterilization 160 degree centigrade for the 1 hour. Ethylene oxide sterilization for heat sensitive items. Glutaraldehyde Sidex high level disinfectant. Alcohol 70% intermediate level disinfectant. Bleach 1% sodium hypochlorite for the blood spills. Hepatitis B vaccination given in for the bath 1 month and 6 months of the schedule. Needle stick injury. When the needle stick injury happened, then at first wash it, then report it, and then post exposure of the prophylaxis. Next, sharp disposal. Puncture proof container, not the recapped. Biomedical waste. Yellow for the infectious, red for the plastics, white for the sharps, and blue for the glass or the metal. Universal color coding. Black for the general waste. Insertion not used for the plastics and the radioactive waste. Radiation safety. Time, less time. How much less time you can stay there? This stay less time, and make the distance properly, and shielding TDS principle. Next, nutrition. We have to next topic. Normal calorie requirement per day is 2000 to 2500 kilocalorie per day. Carbohydrates 4 kcal gram per gram, proteins 4 kcal per gram, fat 9 kcal per gram. Water requirement 30 to 35 ml per kg per day. Protein requirement 1 gram per kg per day. Normal adults. Iron requirements for the male 17 mg per day, female 21 mg per day. Folic acid requirement 400 mcg per day. In the pregnancy 600 mcg per day. Vitamin deficiency. Rickets osteomalacia. Due to vitamin C deficiency, it can cause the scurvy. For vitamin A deficiency, it can cause the night blindness and the xerophthalmia. For the vitamin B1 deficiency, it can cause the beriberi. For the vitamin B12 deficiency, it can cause the pernicious anemia. Kwashiorkor, protein deficiency. Marasmus, calorie deficiency. Obesity, we can tell when the BMI is greater than 30. We can tell it's an obesity. Normal BMI is 18 to 24. Next, BMI formula. Weight in kg by height in meter square. Malnutrition screening tool MUST and MNA. Clear liquid diet. What is the clear liquid diet? Tea, clear juice and broth. Full liquid diet is milk, custard, ice cream. Next, soft diet. Easily digested, low residue. Eternal nutrition via GI tract, NG, PEG. Paracetamol nutrition, IV route, central or the peripheral. Elimination. Normal urine output is the 4.6 to 8. Specific gravity is 1.010 to 1.030. Oliguria. Oliguria means when the urine is less than 400 ml per day is known as the oliguria. Anuria means when the urine is less than 100 ml per day. Output. Polyuria means when the urine output is more than 3 liters per day. Dysuria means painful urination. Hematuria means blood in the urine. Next, proteinuria means protein in the urine. Catheterization. Indication. Retention for the surgery and monitor output. Foil catheter size Foil catheter size mainly used for the urinary catheterization. For the female 14 to 16 French and for the male 16 to 18 French. Next, condom catheter external for the measles. Suprapubic catheter used for long-term drainage. Thank you everyone. Please like, share and subscribe.